Joey Fox has our next question.
So, Mr. Spadia, Republicans in Washington are debating a Medicaid plan that could result in as many as 360,000 New Jerseyans losing Medicaid coverage. As you sort of think about your broader affordability agenda for New Jersey, how would that account for potential reductions in federal health care funding and more uninsured New Jerseyans?
Well, first of all, at the federal level, we're spending too much as it is because you've got, and remember, New Jersey taxpayers are federal taxpayers. So we're all paying into a system that isn't working. And again, when it comes to Medicaid, I look at the $6.2 billion that New Jerseyans are paying for our share of Medicaid and have to wonder how many of the illegals that my opponent wanted to give a driver's license to are taking advantage of walking into an emergency room and using that as their primary care physician. So the reality is we need to cut the waste and the fraud and the abuse. By ending the sanctuary state, I believe we can save the taxpayers of this state about $1.5 billion because we owe it to our disabled community. We owe it to the folks that are suffering from long-term illnesses. The idea that government is throwing money at nearly 1 million illegals in this state is outrageous because you've got families with children with disabilities that are waiting sometimes 9 months to a year to get proper funding, to get medical care, to see a specialist. It is absolutely unacceptable. So I look at cuts as a drive toward efficiency, but not one person who is in need will go without help.
John Bramnick.
Well, you know, I hear waste, fraud, and abuse. You know, I like the concept, but you have to actually look closely at every cut. I think sometimes we cut across the board without actually doing the forensic audit. And any business, they don't just cut across the board. What they do is they look at the programs that are successful, they study the programs, and then they cut. What's happening, in my judgment, in Washington, it seems as if it's happening awfully quickly. If there's a sit down and we can go over the Medicaid money in New Jersey, that makes sense. But to cut it, to be honest with you, I hope the Republicans in Washington stand up, support New Jersey, and not make those cuts.
Jack Chitterelli.
I think Bill is referring to the illegals that he wanted to offer a pathway to citizenship and amnesty to. But the best way to solve Medicaid is to prevent waste, fraud in Medicaid. And it's a multi-billion-dollar program. So I think that the president is right in trying to hit the reset button in eliminating waste and fraud. Here in New Jersey, Phil Murphy has given Medicaid automatically to anyone who comes here illegally. I don't think that's right. I think it's reasonable to expect to look every 6 months whether or not able-bodied people are eligible to get off of Medicaid by working. Also in New Jersey, a married couple with 2 children, up to $114,000 a year in family income is eligible for Medicaid. I think that's a bit too generous. I'm not saying that $114,000 a year isn't lower middle class in New Jersey, but those are some of the cases in which I think we've been too generous. But the best way to save Medicaid is by eliminating the fraud in the Medicaid system.
So I mean, Mr. Bramnick brought up the idea that, you know, he thinks that maybe Republicans in Washington are being too hasty or going sort of too fast with some of these cuts. I'm curious to ask both of you, Mr. Spadia and Mr. Chitterelli. I'll start with you, Mr. Chitterelli, for this. You're pitching yourself as a Trump defender, generally, you know, sort of a Trump ally in New Jersey. What do you do if you're governor and Trump makes cuts in Washington, or Republicans make cuts in Washington that impact your ability to generally deliver for New Jerseyans? Not just specifically on Medicaid, but on any of these programs.
Did not the recession back in 2011 impact our ability to do this and do that, but yet we met that challenge? And I believe we can meet this challenge. But the first job of any governor is to provide for the public health and safety. And that means taking care of our most vulnerable people, whether it's people with intellectual and developmental disabilities, people on Medicaid. We will find a way. Every governor deals with a new set of priorities given on the circumstances at that time. I'm confident our Governor Chitterelli will meet that challenge.
Just want to say one thing.
Can I let Mr. Spadia? Oh, okay.
I'm going to fight for New Jersey, even if it means disagreeing with Washington Republicans. New Jersey's got to come first. It's simple as that. You have to stand up. You have to stand up for this state if you're the governor, period. You can't follow one voice. You have to listen to the voices of New Jersey residents.
Mr. Spady, would you like to?
Well, at least Senator Bramnick answered the question. I'm not so sure what Jack did except dance around because he's so scared now to oppose anything Donald Trump says because he's got the endorsement he's got to protect. Here's the reality. You can check any number of Jack's mailers or commercials. I have had a public career of never being afraid to disagree with those in power. I have absolutely disagreed with President Trump on multiple occasions. Just ask this guy. And you know what? Disagreement is okay. You have to protect this state. Now, I'll give you a recent example happened today. The Trump administration has now dropped the objection for Empire to go and build these wind turbines off our coast. Absolutely outrageous. We will take that to court. We will fight it every step of the way. We're not going to build wind turbines off the coast of New Jersey. And I don't have to answer to a bunch of lobbyists like he does who are supporting these same companies.